On a Friday at 6 p.m. Eastern Standard Time, here we are, bringing you guys a bit of an emergency. It's a woo!
We've been overdue for this.
It's been some time. I believe the last time we did a true emergency podcast was relating to CMS Final Rule 2024. And indeed today, on the same day that Dr. Oz gets officially voted in as the next CMS administrator, a CMS final rule drops once again, 2025. Glenn, your reaction to this breaking news, this emergency of all emergencies?
First of all, for those of you who want the receipts, I'm putting the link in the comments. So boom, receipts in the comments if you want to see it yourself. My first reaction is frustration. I had all week to handle something like this, and for them to drop this Friday afternoon as we're getting ready to go to Miami.
Right. The two of us are preparing to leave Monday morning early to Miami.
I'm not kidding.
Almost a week.
I'm not kidding. When you texted me, I was literally looking like for what bag I'm going to be packed. I was literally like, I'm thinking, okay, I'm like, it's getting close to, a couple days now. Probably should start looking at my suitcase. What am I going to start packing? And then you text me, you're like, final roll. I'm like, what? What?
Well, shout out to Steve Pomerantz. He sent me the funniest message. He sent me the document. And he's like, I'm sure you've read every word of it already, but here you go. And which was definitely funny. It's about 480 pages, give or take, which is, sounds like a lot, but it is certainly a dramatic improvement versus last year's final rule. For those of you that remember, it was north of 1,300 pages. So, you could say that this final rule has been cut down dramatically by 700 to 800 pages. So we'll take it. Save the paper. Save the lawyers typing their fingers away, typing their lives away.
Yes.
Typing things they don't understand. Right? They're like, what are we writing? I don't know. Shut up. We're on the clock.
We get to bill per word.
How do I make this sound as long as possible? TPMOs, also known as FMOs, administrative payments. Administrative payments could mean, I'm like, per word, guys, per word. So let's just kind of jump into this a little bit. So what I'm going to do is I of course have not read through the entire thing yet, but what I did was I uploaded the document into ChatGPT and had it summarize it for me. And Glenn and I together were kind of going through and searching various keywords and things like that. And I have some definite thoughts. But my first reaction, I'll let you guys be the judge of it. I was actually so pleased and encouraged after kind of getting an idea of what we were looking at in this final rule. Let's see.
I read about 10% of it, kind of speed reading. I did, so collectively we did a few things. We utilized AI to try to give us a summary. We did some keyword searching in the document based on keywords from last year's final rule to see if there's anything that kind of lined up there. And then also, I just kind of looked at about 10% of the document and was just kind of doing some speed reading, going through it, trying to figure out exactly what we're looking at. And obviously, again, because we haven't actually read everything that's in this, not to say that there couldn't potentially be something that we haven't caught yet, but early reactions so far from what we know, from what we've seen, it appears to be nothing like last year's final rule. So that being said, let's go through this. Let's go through
Yeah.
the AI summary here.
Not a lot that has to do with agents. Now, this could be due to the fact that most of the specifics that have to do with agents is still being litigated in court right now, and they might just be kind of waiting to see how that plays out. So that might be the reason why they might think about it from the perspective of like, we still have this pending 2024 final rule. Why put out another final rule that has to do with agents when the last year's final rule hasn't even been really settled yet? So that could be a big part of it. As I mentioned earlier, Dr. Oz was officially sworn in today, voted in today. So that could be another part of it as well. So yeah, not a lot to do with agents. You heard it here.
Thank you, Mehmet. Thank you, Mehmet.
Okay, so here's a couple of
Mehmet came in, just threw half of it out. They're about to publish it. He grabbed half of the final. He's like, nope. He just throws half of it out right away.
Yeah.
I'm just making that up. That
not all heroes wear capes. Not all heroes wear capes. So okay, here's the AI gave me a bit of bullet points, right? And then I want to go through some of the things that you were searching for as well in the document.
Yeah.
But we'll start here.
Yeah.
So number one, implementation of Inflation Reduction Act provisions. So vaccines, no cost sharing or deductible for adult vaccines recommended by the ACIP under Part D. Insulin, no deductible, monthly cost sharing. So a lot of this part of it is already kind of included in the Inflation Reduction Act. So it's almost like they're putting it into Medicare rule and including it into the final rule. Medicare prescription payment plan, we already know about this as well, allows enrollees to spend to spread out their out-of-pocket costs over the course of the year into monthly payments. Nothing new there. Dual eligible special needs plans, DSNP enhancements, integrated ID cards for both Medicare and Medicaid, unified health risk assessments, codified deadlines for HRAs, and individualized care plans, emphasizing enrollee involvement, star rating adjustments, new breast cancer screening measure added for the 2029 star ratings. So, impacting star ratings. So far, virtually almost nothing that's either new or has anything to do with us as agents. Timely prescription drug event, PDE reporting, 30-day submission, deadline for initial PDEs, 90 days, et cetera, right? Medicare drug price negotiation program. Pharmacies and Part D networks must enroll in the Medicare transaction facilitator data module to ensure accurate pricing and availability of negotiated drugs. Improved coverage determination for MA plans, clarifies coverage decisions made during inpatient stays, restricts plans from using post-admission data to retroactively deny coverage. Sounds good to me.
Yeah.
8 risk adjustment updates, updated HCC definitions, mandates, risk data submission by PACE organizations and cost plans. Financial impact overview, vaccine cost sharing, no impact on trust fund, insulin cost sharing, negative 1.2 billion increase in federal transfers 2026 to 2025. Other provisions, mostly no financial impact on the Medicare trust fund. Public comments. CMS has received 31,000 public comments, many supporting the Inflation Reduction Act provisions. Wild to me, first of all. That just tells me that most people don't understand it. Some proposals regulating AI and Medicare Advantage, anti-obesity drug coverage were not finalized, but may be considered in future rulemaking. We've heard that language before. Effective dates. General rule effective June 3rd, 2025, applies to coverage starting January 1st, 2026. Yeah. I mean, that's kind of it. And Glenn and I, like I said, we did not just rely on the AI breakdown. We also went through the document as a whole and did some searches on it. I don't know if you want to share your screen, good sir, and go through any pieces of it yourself on your end. But
Well, here's the thing that makes me most confident about this not having anything in it that we should be seriously worried about. And ironically, and I will say this for all you Chicken Little agents out there, I did have a stone in my gut when I'm open, and I could kind of hear it, I think, through the phone on your end a little bit too. It was just like, all right, when do I die? When do I die? You're just like going line by line. You're like, are you taking on my compensation? No. That's just scary.
I'm like, do I have to sell my house?
Maybe I'm not going to Miami next week. I don't know what's going on.
Sorry, agents. We can't afford it anymore. Did you see this final rule?
Yeah. It's gone. And it's gone. But here are some key words that were in the last final rule that there were several mentions of, pertaining to us, pertaining to our compensation that I searched for and then looked at any mentions of these key words, and there was nothing. Or if the word did show up, it was being used in a different way. And one of them was override. So override was in the previous document, specifically talking about an FMO's compensation or a TPMO's compensation. The word override that was found in this document was only 3 times, and it was used in the sense of like overriding a claim, something like that. So there was nothing regarding agent compensation with the word override. I looked at agent, again, a few mentions, but nothing specific regarding anything compensation related. There was it was like twice in the cliff notes, and then like one random spot where agent was mentioned. So essentially nothing with agent. Broker wasn't mentioned at all in this document.
Not once in the 480 some odd pages.
Yes. And compensation was also not mentioned once. The word payment was mentioned about 980 times, but when I quickly scanned those, it all seemed related to like claims payout, prescription drug payments, stuff like that. A lot of this is behind the scenes technical stuff, similar to what Christian just showed you on that AI summary. So, and then just to really feel good about it, I took probably the last, I'd say 50 pages, and that's what I really skimmed. I just was really looking, kind of pretending I was ChatGPT and was just speed reading it, looking at the comments and responses, which is usually kind of a interesting takeaway from, what is in this document, what the document is pertaining to. And ultimately there was nothing. And it was almost shocking to have this feeling, because as soon as I get this text and then phone call from Christian, I'm like, I'm waiting for the other foot to drop. I'm genuinely waiting for the other foot to drop. We went live last year when final rule dropped.
And you accurately pointed out it.
Yeah.
If we remember correctly, it was the same day on a Friday, same situation.
It was the same day. It was like April. It was the first week of April, and I think it was a Friday, if I remember correctly. I think they literally dropped this like clockwork.
It was like, have a good weekend. Fuck you. It's kind of like what they did last year. It's like, hope
it's allowed on the emergency podcast. Okay.
Sorry.
That's allowed. That's allowed.
Sorry, children.
I'm sorry. Sorry, little Millies, little Billies.
Now, that being said, we're not completely out of the woods yet, because 2024 final rule still being litigated, right? There's still a decision to be made there in that court case. We were told on the Seven Figures or Bust podcast, which this is not, it's an emergency podcast. But we were told on the Seven Figures or Bust podcast in March that by the end of March, there was going to be a decision made by the judge. In that case, that clearly was wrong and not true.
Yes.
Um,
We were told
and so, we're not completely out of the woods yet, but I can tell you this from my perspective, from where I'm sitting, just based on what I know going through this a little bit with the last 30 minutes, 45 minutes or so since this dropped on on my lap. It's very encouraging, right? It's very, very encouraging. Seems like, and here's the thing that's in addition to this. Remember, CMS put out a proposal that looked really frightening and very scary during AEP at the end of Q4 that had a lot to do with changing the definition of marketing and communication. For those of you that don't know, marketing is something you have to go through CMS approval for, get an SMID code. And historically it was anything that had to do, historically, it was anything that had to do with plan, benefits, carriers, specifics, right? But communication was educational, where you're talking about Medicare generically. They were going to change that to where it was all one. So like if you make a Facebook post about Medicare, you were going to have to get a CMS approval for that Facebook post or a YouTube video, just radical stuff. So like you're seeing that proposal come out, and then you see a final rule come out that doesn't mention anything that I saw in that proposal. Super encouraging to me. Super encouraging. And it to me it kind of points to a suggested change of direction for CMS, that it's like they don't need to hold the magnifying glass over us and fry us, like ants, they don't have to do that. You don't have to do this, CMS. You don't have to do this. Burst into flames and everything like that. So I thought that was super interesting because I thought, surely we're going to get some version of that proposal in this final rule, but no, I didn't see anything about it.
Yeah, I'm looking at marketing was a term I didn't search for. So there's a few hits for marketing, 13 hits total. Some of it is benign. It looks like there's some reference points in here. Let's see. So there's some reference points, I think, to the 2024 marketing and communications rule. I'm assuming this is potentially talking about, what's ultimately being held up with that stay in the court system right now. So that's still the other potential foot to drop. Obviously, we don't know exactly what's going to happen with that or when it will happen. Like Christian just mentioned, we thought we would already know that by now. But the good news is Mr. Amendment Dr. Oz is officially in power, officially voted in. So I'm assuming he'll be getting to work bright and early Monday morning for us, hopefully. And like Christian said, I think we could view this with the lens of we're starting to see some positive changes. We said this before, and I'll say it again, cautiously optimistic by what we're seeing. Cautiously optimistic. That would be my key takeaway from this is, this could have easily had some more length, especially with the old CMS administrator essentially, coming out of power. This could have been their final moment. Think about it. Literally their last day they're in charge. They could have easily laced this thing with all sorts of craziness and tried to really mess with us. But here, it looks good so far. On the surface, it looks good. What we're seeing, what we're hearing. So I am cautiously optimistic about what this means and what the future will look like. But as always, stay tuned. Christian and I will come live, right here in the group, share what information we know as soon as we know it, and continue to work through this all as a community. We're all a part of this.
Yep. These are things that impact all of us. And, it is crazy to kind of see what can happen in a year's time frame because, we kind of reflect back on a year ago, basically today, this rule drops last year, and the panic and the fear that it basically spread throughout the industry as a whole. Everybody was talking about this thing. Everybody was feeling, scared and uncertain about our future. From people that worked at carriers I would communicate with, people at other FMOs, all the way down to the street level agents and the, guys in the field, everybody was uneasy and kind of nervous about this thing. And again, like we said earlier, we're not out of the woods yet. That is still being kind of pended in the court case, but we'll see. We'll see kind of what ends up happening with that. But yeah, I mean, the last time that CMS put out a final rule that did not involve trying to step on us post-pandemic or pre-pandemic,
Yeah.
I mean.
Yeah. It's been a while.
I had hair. You know what I mean? You
we
had
weren't
hair.
married yet. This was before our marriage.
Yeah. Like, maybe it was like right after the pandemic. It might have been 2021 or something was the last time. But
it was 3 or 4 years ago. It may have been right after the pandemic, but
it feels like a long time though.
It does. I did want to take a second too and kind of essentially plug the 7-Figure Medicare Agent Summit, you guys. That's just right around the corner. We're about 2.5 months away. I believe June 22nd to June 24th in Salt Lake City, Utah. If you haven't already bought your ticket, they're 30% off right now for a limited time. We also only had about 100 tickets left at the start of this month. We've already sold a chunk. So there's a chance we sell out by the end of this month based on what we're seeing. We have a limited capacity based on the hotel and the reservation that we made for the event. So, if you want to stay up to date and you really want the latest and greatest information going into AEP, it's kind of part of the strategy behind why we do the event when we do it. A lot of people do events early in the year, March, April. Sometimes the wheel of information is still spinning, and it seems like we're able to deliver the latest and greatest when it comes to what's really going to happen going into AEP. That seemed to be the case last year, and I think it'll be, again, kind of the same situation this year. So if you haven't already, grab your ticket to the 7-Figure Medicare Agent Summit. I'll make sure to link that in the comments below as well.
Yep. Yeah, guys, I mean, the news is not much news. And let's be grateful about that.
No news is good news, right? Yes.
I mean, for me personally, I'm going to go into my weekend humming, singing.
Back to packing, baby. Back to packing.
Yep. Packing for Viva Miami. I don't think they say that. I don't think anyone says that. But
they
Viva Miami. Viva Miami.
Viva Florida.
Viva Florida. Of course, guys, as we learn more, we'll be sure to update you real time. For the vast majority of these updates, you can catch them on the 7 Figures or Bust podcast. So make sure to tune in for that. For those of you that are avid watchers, and you might have missed the last episode we did yesterday, we were not planning on doing anything today. Like live streaming or anything. But if you missed yesterday's episode, we are off all next week in terms of the show. We will return the following Monday. So as we get updates, we'll bring them to you, and that's usually going to be the best place to catch them. So any final words, Mr. Shelton, Mr. Glenn?
I think someone said they heard street comp went to 900/450. So that would be an increase, would it not?
It would, but I didn't see it in the document. Did you?
Yeah, I didn't see anything about that. I mean, again, we kind of tried to attack this from a few different angles. I'm all for that. I'm all for getting paid more if that's where this ends up going. I'm not going to complain about that.
Imagine that's the end result. Cut the whole original thing was cutting brokers' commissions and administrative payments, and ends up agents can make more money. That's the net result.
Yeah, that seems to be unsubstantiated so far. I haven't seen anything about that specifically, but I'm all for it. Brian, if that ends up being the case, let's go. Increase in comp for us.
If there's a
Um,
spot we missed, certainly please let us
yeah.
know.
Yeah, I mean, part of what I wanted to do with this live as well, you guys, if you did make it to the end here, and I'll kind of share my final thoughts, we can kind of use the comment section if you have information that you find or a specific line that you're worried about, feel free to drop it in the comments below. Christian and I will try to answer any questions you have, and try to dig deeper. Obviously, we're going to be talking to everyone in our network over the next few days, several weeks about what's going on. And so again, we'll try to get as much updated information to you guys as humanly possible. But oh, it's a joke. Brian, shame on you, Brian. Ban him from the group. Ban him from the group. I'm just kidding.
We love Brian.
We love Brian.
We love Brian.
Yeah, that's really my final thoughts. No news is good news. Cautiously optimistic. We'll keep you guys posted as we learn more.
Thanks, guys. Have a good weekend. And we'll see you not next Monday, but the Monday after, when we're back live with Seven Figures or Bust podcast. Thanks, everybody. We'll see you on the next one.